Hello friends, let us now learn some important points about acute tonsillitis. Acute tonsillitis is more common in the school-going children than adults. It can be most commonly it is due to viral infection followed by bacterial infection. Viral infection In the viral infection, most commonly it is due to adenovirus followed by Epstein-Barr virus, influenza, parainfluenza and enterovirus. In viral, most commonly it is due to adenovirus. Then in bacterial, it is most commonly due to group A beta hemolytic streptococci. Others like staphylococci, Haemophilus, pneumococcus, all those can cause acute tonsillitis. If you see, the acute tonsillitis is of four types. It can be acute catarrhal tonsillitis or superficial tonsillitis, acute follicular tonsillitis, acute membranous tonsillitis, and acute parenchymatous tonsillitis. In acute catarrhal or superficial tonsillitis, here the mucosa of the tonsils, if you see, this is inflamed. Here this is the mucosa of the tonsils which is inflamed. This catarrhal tonsillitis most commonly occurs due to viral infection. Then in acute follicular tonsillitis, you see, in acute follicular tonsillitis, here you see the infection spreads into the crypts, and the crypts are filled with this pus-like material. This pus-like material which is present in the crypts is called as acute follicular tonsillitis. This is main important in acute follicular tonsillitis, where you can see these crypts-like material, this pus-like material which you can see. This is seen like yellowish spots in follicular tonsillitis. Then we have acute membranous tonsillitis. This is acute membranous tonsillitis. Here you can see formation of membrane over the surface of the tonsil, even here. Here mainly this part. Here you can see formation of membrane over the surface of the tonsil, which is called as acute membranous tonsillitis. Then we have parenchymatous tonsillitis. In the parenchymatous tonsillitis, the tonsils are affected and they are swollen. You can see the swollen tonsils and they are uniformly enlarged. So in acute tonsillitis, the child presents with fever, headache, malaise. The child will have sore throat and difficulty in swallowing. He can have foul breath. There can be foul breath, and there is also coating of tongue is also seen in the tonsillitis. Earache, the child also suffers from earache. If you see the diagnosis, if you squeeze these crypts, if you try to squeeze this tonsil, crypts of the tonsil, you can see the pus which is coming out from the crypts. If you just try to squeeze the tonsils, then you see that the pus is oozing out from the crypts. So if you see the signs are all these like swollen tonsils or inflamed tonsils, the yellowish spots present over the tonsils. Sometimes you will also see jugulodigastric nodes are enlarged. Jugulodigastric nodes are enlarged is also seen sometimes. So treatment is, you should treat it with antibiotics. So you can use either crystalline penicillin can be used, or you can use amoxicillin for 7 to 10 days. But if you were asked about the drug of choice, then amoxicillin is the drug of choice for acute tonsillitis, which is given for 10 to 12 days. Then we have grading of tonsillitis in tonsillar hypertrophy. Grading of tonsillar hypertrophy is based on the percentage of projection of the tonsil. It is the percentage of projection of the tonsil medially from the anterior tonsillar pillar. So if you see, this is the uvula, and these are the tonsils. You will have here anterior tonsillar pillar. So from this anterior tonsillar pillar, the projection, that is the enlargement of the tonsil which occurs, is called as tonsillar hypertrophy. So based on this projection, we will grade it into 1 plus, 2 plus, 3 plus and 4 plus. 1 plus, if the projection of tonsil medially is around 25%, that is, if there is up to 25% projection, then we call it as 1 plus. If it is up to 25 to 50% projection, it is 2 plus. 50 to 70% projection, it is 3 plus. 50 to 75% projection, it is 3 plus. 75 to 100% projection, it is 4 plus. So sometimes this tonsillitis is also associated with group A beta hemolytic streptococci. Association of tonsil with group A beta hemolytic streptococci is given a name called as pandas, because this tonsillitis infection due to beta hemolytic streptococci is associated with tics and obsessive compulsive disorder. So that is given the name as pandas, which is pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. Pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So if you see the complications, in the complications we have different complications, because first, whenever there is tonsillitis, this enlargement of tonsils this infection can be due to streptococcal infection. If this is due to beta hemolytic streptococcal infection, then it can affect the heart and result in rheumatic heart disease or rheumatic fever. This acute tonsillitis, if it does not resolve, then it can progress to chronic tonsillitis. This streptococci can also affect the kidney and it results in glomerular nephritis. The infectious organisms can also reach the heart, causing subacute bacterial endocarditis. Then, because of this tonsil, the infection can spread through eustachian tube to the middle ear, causing acute otitis media. So these are the different complications of tonsillar hypertrophy. Chronic tonsillitis, acute tonsillitis. These are the different complications of acute tonsillitis. Next, now important thing is differential diagnosis of membrane over the tonsil. In differential diagnosis of membrane over tonsil, one, we have trauma. It can be due to trauma or tumors of the tonsil and the aphthous ulcers, or it can be due to infections like candida infection or diphtheria infection or tonsillitis, or it can be due to Winsett's angina. All these show membrane over the tonsil. So this is about acute tonsillitis. Thank you for watching my lecture. Thank you.